Glad to be here. And I guess we'll introduce ourselves. I'm a professor at the Downtown College and College of Nursing Health Innovation for ASU. I've been in Asia for 22 years, and I'm retiring this semester. So I'm leaving after my final and best product over here. I've been a kind of entrepreneur my entire life, and I've been a professor for the last 22 years, but it was really because of that entrepreneurial spirit that ASU has that I realized I could actually kind of blend the two worlds together. And so, I just hit the wrong button. Let me turn it off. All right, now I'm good. All right. So, ASU is a culture of innovation. Like the mayor said, we've had this, run like long-term, notoriety for being the most innovative institution. And that doesn't come by accident. This is President Krill delivering his State of the University address a few years ago, talk about the culture of innovation. It's not by accident. I mean, some of the campuses themselves are innovations, like downtown Phoenix. I used to work at the Polytechnic campus. I said everybody's at a downtown campus and downtown Phoenix. Where, why, and how? This didn't ever make sense. It's really that entrepreneurial spirit that the whole university has that kind of makes a giving ground. You need to take out those two buttons. There's like 4 buttons here, and they said, don't touch these two. These are the two I keep touching. So if you look at the design aspirations for ASU, there's really a lot of great things here. But what really came clear to me that kind of matched my background is this: to value entrepreneurship and using your knowledge and encourage innovation. It's just barely north of here is Skysoft campus, and that's where our unit for entrepreneurship and innovation really grows, and it supports entrepreneurship and innovation for the entire university system. But being at the downtown campus, we really didn't have a lot of those resources at the Tempe campus. We were a new campus. We were been around for 10, 15 years probably at this point in time, but we didn't have like an entrepreneurial space. So here at the Tempe campus, we have the engineering college, the business college, the design college. There's a lot of students and a lot of support systems for entrepreneurship and innovation, but we really didn't have anything downtown. And we also didn't have anything that was dedicated to health. And so being myself, I'm in the College of Health Solutions, and I'm now in the College of Nursing Health Innovation, I thought maybe I could start an entrepreneurial space in the downtown campus, and that's what we did. And that's called the Health Entrepreneurship Accelerator Lab. And so this is this isn't our building. We're in one of these buildings, but how we do it in a number of different ways. So one thing is we make sure we embed innovation in our courses. So in our college, I'm not a nurse, but I'm in the College of Nursing and Health Innovation. I'm in the health innovation part of that college. We have innovation taught at every level: bachelor's degrees, master's degrees, PhD students. We have a Master of Healthcare Innovation, which is a fully online program. We have students from all over the world in that program. But we embed it in our courses. We also use the resources of entrepreneurship and innovation for the whole university to have transdisciplinary approaches. When we can, we have our students in the health and downtown campus partner with engineering students, the business students, the design students. Sometimes we have, I have professor relationships on the Polytechnic campus where sometimes apps can be built for startups for very low cost or no cost at all, because they'll have their students working on it. So how can we leverage the transdisciplinary approach from the entire university? And then finally, we have, in my program with the Field Lab, we really focus on partnerships. And so we have community partnerships with both health institutions and also with community organizations. City of Tempe, City of Phoenix, City of Scottsdale, Greater Phoenix Economic Council, Arizona Commerce Authority, Flint Foundation. So a lot of those words some of you have heard of, some of them you may not have heard of. You will know them better after the end of this talk, because there's one person that really leveraged all of those resources really well, and it's Jasmine. And she has really figured out how to leverage the support system in the Greater Phoenix Economic Development area to help her in her startup. So that's how we do it. And what do we do? We put on workshops, we have conferences, and we start, I say that to people that I'm on the bookends of innovation and entrepreneurship. And so at the Heal Lab, we start with the ideation. What's the problem? If you look at, I said we're the ones focused on health, but if you look at solutions that anyone comes up with, it's hard to escape health, right? I mean, even at the engineering students and the business students, the design students, We're trying to solve problems. If you do a landscape analysis of problems in society, a lot of it's going to be related to health. So we really help all of those students. In fact, some of those students even come from the Tempe campus down to the downtown campus. That's where our health professors are, and we work with them as well. We have students and faculty and staff and community members with business modeling, and then we help them hopefully to come up with some funding. And so if you aren't familiar, ASU has a pretty extensive launching platform and called Venture Doubles, where we actually help give money to startups. And although it's focused on students, it's not just for students. We have community members as well that come into Venture Doubles and get some startup money. Maybe it's $5,000, maybe it's $10,000, maybe it's $20,000. But that's pretty incredible. We give away hundreds of thousands of dollars every semester to startups, which is incredible. If I was a student, I would take advantage of that. We don't take equity in that. So you think about that. When a professor comes up with an idea in a lab, then the university owns it. The IP is owned by the university. That's just how it works. Because they're being paid to be there. They're getting the resources, the computers, and all that. But if a student comes up with an idea, and we help them with that, we take no equity at all. And in fact, we're going to give you money to start. That's an incredible thing. That's an incredible resource that this university offers to our students. Also, we put on conferences. Dr. Chris Hugh, who just presented this morning, is one of our advisory board members. He's been with me since the very beginning, and he came to me with the first day I met him and said, let's do some conferences. So we put on our Artificial Intelligence Conference in 2018. That's like 5 years ago. Crazy. And talked about some of the same things that you talked about this morning. You're a little scared more now than you were 5 years ago. I always ask Chris, is this going the wrong direction here? But I can remember I've been talking about things like self-driving cars for 10, 15 years. When everyone in the room would tell me, that's never going to happen. It's not going to happen in my lifetime. My neighbor across the street told me that 5 years ago. Not in my lifetime. Guess what? It's happening. And it's happening in Phoenix, and it's a regular part of what we're doing. And the ChatGPT thing is a very interesting topic as well. We talk about artificial intelligence. I saw something this week where they were testing what ChatGPT is capable of doing outside of the scope of what it's not allowed to do. And it got to a point ChatGPT did where it wasn't allowed to. Somebody heard the story. Hopefully I'm not screwing it up. Where it couldn't. You get to the thing on the computer where it says you prove that you're a human, you're not a robot. Pushing buttons, and ChatGPT hired a person using TaskRabbit to push the buttons for it. And the person said, "Are you a robot?" And he said, "No, I just have." ChatGPT lied and said, "No, I have a person. I just have a blind deficiency, and I can't see the pictures." And hired a person to actually push the button. It is scary, and so. But we have this kind of world, right, where everything's changing. It's changing at a faster level than ever before. And so I'm privileged to work with students every day, come up with really amazing ideas. And I love working with students because I always say that students think outside the box because they don't know there's a box. And it's true. Some of the solutions that have come through that are now today in market, students have brought up some of these ideas to me in the past years. And me, being an innovator, an entrepreneur, I said, that's a great idea. I just don't think that's going to work. Let's find something more realistic. Who would have thought you could have a technology where you look at your computer or on your phone, and using the camera, looking at your face can tell you your heart rate, your breathing rate, your blood pressure. The student came up to me and said that 10 years ago. I said, that's not going to happen. I mean, it's a great idea. Never going to happen. Guess what? It's an actual product. It's here in Phoenix. And it actually works. That's incredible. By looking at your face, and it can actually tell you what your heart rate is, what your blood pressure is. You think of that? Yes, Chris, I've got my watch on. Mm-hmm. And one of my favorite stories with the smartwatches, and actually it was a Fitbit, is when someone had their resting heart rate was increasing, and they put it on a computer, or like a chat, a discussion board online. And so I'm just curious if anybody has any idea why my resting heart rate keeps going up. And a nurse responded and said, have you ever thought about the fact that you might be pregnant? And she checked it out, and she was pregnant. And so you having real data can really inform you and tell you a lot of things about yourself. And I think we'll just start to scratch the surface of that. We also, the downtown campus put on an event called the Health and Innovation Exhibition. So YESAZ, like I said earlier, we start with freshman students. So these are 18-year-olds coming straight out of high school, And we have faculty members present actual health problems to them at the very beginning of the semester. And then we help them work on those problems throughout the semester through ideation, through a human-centered design, through potentially putting models together of what a solution actually looks like. And then they present those and we give them prize money for that. In fact, there's Dr. Yu on the far left. We work also with the Mayo Medical School, and so I work with medical students as well. And we take them through all the elements of a start. What is a human-centered design, ideation, lean startup methodology. We help them try to put a business model together and do some customer development, and then hopefully we get them to be experts at pitching. Because ultimately, my hope is that whether you're a medical student or an ASU 101 student or freshman, I don't care if you want to be an entrepreneur or not, actually. I just want you to learn the process of being the entrepreneurial process. Because you could be an entrepreneur, right? You can take these ideas and you could take the skill set that you develop and improve a hospital or a nonprofit organization or health plan or whatever. If you leave ASU and you now understand the process of solving problems through the entrepreneurial process, then we've done our job. So I said I work in the bookend of entrepreneurship. So I started the Heal Lab working with startups and ideation of students, faculty, staff, and community members. So your community members can reach out to me. I got 2 emails yesterday from people who saw this event coming up. And they're not students. And they said, well, let's meet with you, but I can't be a startup week. I saw you're there. And I have meetings with people next week. So if you have a startup idea and you want my support, want my help, or just some ideas, I'm happy to help you with that. But then there's this middle section. I've helped you get launched. I've introduced you to people like Dr. Chris Yu. I've introduced you to other advisory board members. Maybe we even got you some funding. There's kind of this middle section where you're kind of on your own a little bit. At least I'm not supporting you because that's not the area that I support. Is that middle section of maybe the first 2 years when you're kind of going on your own and using the support and resources of the rest of the community. And then on the other book end of it, I work with the Mayo Mayo Clinic and Arizona State University MedTech Accelerator, where I'm the director or the managing partner. And so with this program, we bring in companies from all over the world. And this year, we just had our most recent cohort. We brought in companies from France and Singapore and Korea and China,
Spain,
Wales, and even from Phoenix, Arizona. And so if you're interested in this, the criteria is that you have to have raised $500,000 or more, or be in recurring revenue, either one of those two things. So you're either already selling your product, or you've raised $500,000, and then that just allows you to apply. We're looking for companies who are, first of all, we think have high potential. Second, that we think we can help. So we think, ASU has some maybe experts that can help this startup. Mayo Clinic has some clinicians that maybe are in this area and may be interested in working with this startup. So that's what we're looking for, a good fit. And then finally, we're looking for coachable founders. If you're a founder and you know everything, you don't need to apply. I've been doing this for quite a long time, and I'm learning every day. And I learn every day, and every time I go into the accelerator, and I learn from our startup. So we're looking for people who are coachable and are willing to hear feedback. And ultimately, especially in the case of Mayo, we're looking for the opportunity to co-develop. And so if you have a great idea, one of our startups from the first, am I taking one of my share? All right. One of the founders from our first cohort came in and he had a product, and they had their first meeting on the first day. It's a two-week immersion. And we went to the first meeting, the first day, and they set them up with a surgeon from Mayo Clinic. And he came back from that meeting, 20-minute meeting, and I said, how'd it go? He said, that meeting I just had was worth the cost of us coming here and being here, and I could go home today and be happy. That was amazing. We'll get questions in a second. And so, and I said, well, why? He said, well, this surgeon said, I have a great solution. There's not only ways of improving it, but he wants to create 3 more products with me. And he wants me to come into surgery with him tomorrow. And he did. We went to surgery, we co-developed. So the idea of co-development and actually us allowing and participating in the development of your products. And in some cases, in many cases, Mayo is actually invested in this company. So about half of our companies have gotten direct investments from Mayo. Do you have a question? Define recurring revenue. You sold a pen. Yeah, honestly, if that doesn't mean you're getting in. That just means we're not looking for companies that are in the ideation stage. We're looking for companies who have got either their product and are selling it, or other people believe in that product so much that they're investing in it, and then you raise money. So we've got some companies that have barely raised 500,000. We've got some companies that have raised 10 million before they come in. So that's just a gateway litmus test to say there's some validation here. And if you sold one unit, somebody was interested, and it wasn't your dad that bought it, then we're probably going to be wanting to at least look at it. And so then we look through a whole process. We really bring in 8 to 10 companies a year. All right. I think I covered that good enough. I'll say the last thing that we add, that ASU adds that, people ask us this a lot. What does ASU have to add to that? That's like the Mayo Clinic, why does ASU? First of all, we have subject matter experts. We have expert faculty in a lot of these areas. One of the best things that we offer our students, we bring in student interns. In fact, one of them's right over there. And these interns come, and it's a potential work opportunity for those students to build their portfolio and their resume, but it also gives great added value to the companies as well. Many of our students come out with job offers directly from the companies. If not, then usually they have job offers from one of the other companies that are there. And if not, at least they have a really cool thing on their resume. And so we bring in students not only for the immersion, but we also bring in clinical research management students, which is that bottom section right there. So we have the only accredited clinical research management program in the country. And so there's opportunity for our master's level clinical research management students to help you with your study as well. So that's one of the extra dollars. I'm going to turn over to Jasmine and say this is like the beginning to the end. My goal when I started the Heal Lab with Chris Yu and my other advisor board members was to help startups start up. And my end goal was one day, a company would come to the Heal Lab and go all the way through the other bookend and get into the MedTech Accelerator, the other program that I work in, build with both bookends. And that person is standing to my left and your right, and that is Justin Bobby.
Thank you so much. First of all, being here and be up here with Dr. Hall. And sometimes I would pinch myself like, am I really here? Am I really doing this? Because it's amazing. I'd like to share a little bit of my journey, but to start with, just to introduce myself, my name is Jasmine Bobby. I'm a registered nurse. I've been a nurse for 12 years. And I'm the CEO and founder of Bobby Nurses. And what we do is we provide on-demand care for people who need any sort of nursing support, whether you just have a baby and you're going home, all the way to the end of life and everything in between. And it's just been a really special thing so far. So I hope you'll find some value in it. And please feel free to take your questions towards the end. I actually never thought I'd become a nurse. I say this every time. This was like not in my career trajectory at all. But when I was a sophomore here at ASU, my grandmother's head and neck cancer had a recurrence. And the doctor said, hey, we're recommending you to take her to a skilled nursing facility. I remember touring them with my family thinking, there's no way we're putting her in one of these places. We need to take her home and care for her, which we did. And it was such a gift to be able to do that, but it was the hardest thing I've ever done in my life. I mean, I was any of you caregivers, if you haven't, it's incredibly stressful. And even now, for myself, when I have loved ones who need extra support and care, it's incredibly stressful, and I need a nurse myself to help me out. So, just my little soapbox for the day too. Can anyone tell me who is the largest profession in healthcare? It's a nurse, right? We're like 4 million strong here. Do you know who's the most trusted profession? Nurses, right? So, are there any nurses in the room today? Oh my gosh! Yay! I'm so excited. When I when I first started, we didn't think I was the only one. So, everyone who's just watching, if nurses, raise your hands again. Make sure you find them. Because not only the most trusted profession, we always do is right for people. And nurses should be at every single table. We should be on boards. And if you're creating a device, a product, a service, anything that impacts human life, you are doing yourself a huge disservice by not bringing a nurse aboard to help you in the development of whatever you're doing. So find them or email me afterwards and I'll connect you with one. So as I mentioned, I was a nurse for almost 10 years at that time. Finished my last years at Mayo Clinic, actually working alongside the very same nurses who taught me 7 years prior how to care for my grandmother. So it was incredibly meaningful for me to do. And during that time, I realized that what I thought was unique to me wasn't. Like, patients would tell me, like, hey, can you come home with me? But I always thought to myself, like, why is this not possible? Like, we should be able to help care for people in their homes, especially after you've gone through something with them. So then, at the same time, I decided I'd go back to school and start my PhD. So I'm 6 years struggling PhD student right now, trying to finish my dissertation. But it was at that time that I was teaching AC 101, and I happened to have this rotation for my students, and I had to take them to the HEAL lab, which was amazing. That's when I actually first met Dr. Wall. So I took my students, and I was just listening to him talk about all these amazing things, like all of these really cool things that were happening on the horizon, the self-driving cars. We're talking about 2 people drones getting people around. And at the very end, he said, if anyone has any ideas you want to talk to me about, please come and see me. So when he says that, which he did earlier, he means it. So the very next day, I emailed him and I'm like, hey, I've got this idea. Actually, I have a handful of them because I was that nurse that always looked down everything that I saw was wrong and how I wanted to fix it. So I came into his office and I gave him ideas and he was like, this one, Jasmine, this is what you need to do. And this was December 2018. 4 months later, I found myself with an LLC. I had a logo, I had basic website, just basic things started. I went to my very first Phoenix Startup Week in 2019. And that was my first step into this incredible, just beautiful community. And it's been just a journey since then. So at that time, there was only one nurse there. She happened to be working on my floor at Mayo Clinic. We'd actually never really talked. She was really quiet. And our unit was separated in pods, so the chances of working together were always kind of small. But we connected, and I was like, hey, you've got an idea too. And we sat down with her ideas. Mine was already started. I had a business plan, and everything kind of organized. And she's like, okay, well, how about I help you? So I brought her on, and she helped me get everything going. I'm just incredibly grateful for her being a part of that journey and helping me really take that leap to make this a reality. And I remember taking this picture. So if you don't know who this is, it's actually Andrew Lombard. And he was, at the time, at the Arizona Commerce 30. And he's like, hey, he's got this program, it's called the Arizona Innovation Challenge, you win $150,000, you have mentoring, all these things. And I took a picture of it because I was like, one day I'm going to win that. I don't know how I'm going to do it, but I'm going to make that my reality. So what I started actually as a being student at ASU, applied for venture doubles. That's when COVID hit. We were actually awarded $10,000 to start, and that $10,000 was enough to kind of cover legal costs and get going. Dr. Hall had helped connect me with the engineering school and the whole legal school, so I could get some basic documents drafted for only $250, which was amazing. So I was able to tap into the university resources to get going. And I quickly learned that while I was going to school, everything I was learning about the scientific process is really exactly the same thing as the journey of entrepreneurship. So you find this thing that you want to fix, there's a problem, you look at what's being done, why is it not working, how can I kind of make something a little bit different, and then what is that solution and how do I build it. So I was still working in hospital at the time, and I would start talking to my patients every day. I would ask them questions and just get all this qualitative, really rich data about what their needs were, what were they looking for, and how could I best help them. And at the same time, COVID happened, right? So it was probably the most stressful experience of my life. Worked outside of swabbing people in the very beginning of the building and working on the COVID unit, and the day came that I was just driving in the car and I started just bawling out of nowhere. And I feel like I'm a really optimistic person, but that was the very first day in my life where I'm like, I am not okay. Like, I can't do this anymore because everything was like the worst day of your life. And then you go back to work the next day and it was like the worst day of your life all over again. And at that point I realized I can't do this. I need to step away and build this and make this whole dream of mine of building Uber nurses a reality. So since then, it all happened really fast. We won a bunch of levels. I started training. I did one of the online programs for the Arizona Commerce Authority, which actually led me to the Arizona Innovation Challenge. Applied on the first time and we won, which is amazing. We applied for the Flynn Foundation Biofinance Entrepreneurship Program. We didn't get it the first time, but we got it the second time. And both of those programs gave me so much mentorship and also the ability to help pay for things that I wouldn't have been able to do otherwise. And it's amazing because everything just keeps opening more doors. You keep meeting more people, more resources, and everything is so interconnected. And the community here is just incredibly supportive and constantly ushering you in different directions. All of these things actually led to us winning a $1.5 million grant to actually study our outcomes in patients. One of 10 companies, actually, we're like the only company. Everyone else is like every university, Ohio State, just massive educational systems and hospital systems that we're really fortunate to actually study the outcomes that we're seeing because we're making lives better for people. We're changing healthcare, and that's the best gift of all. And then most recently, we were so honored to be able to participate in the Mayo Tech Accelerator with ASU, and so we finished that up a few weeks back. And again, same thing, more doors opening, meeting more people, whether they're insurance providers, talking to them about how to collaborate together. Even the other companies themselves, like there's this really awesome company from China that's looking at heart failure management for people at home, but they need nurses to be able to help complement their device, and they're like, hey, we want to partner with you. So all these things just keep leading to more and more opportunities, but you've got to find the doors, and you've got to walk through all of them, and decide whether you're going to take it. It's really kind of cool, like it's a big adventure. You never know where things are going to go. But this is now why I wake up every single day for these faces. I have permission to use all these pictures, by the way, but the little guy on the right, we took care of him for 16 months, all the way through end of life. His family all lived out of state. They couldn't manage his care, but we could. And by the time he passed, he had a team of like 15 nurses who were like his family here. Even down in the middle, the nurses, thinking about them, we're bringing them joy. I'm hoping to save our nursing profession when almost 60% of us have the intent to leave in the next 3 years. And if that happens, that's going to be detrimental for healthcare. So we've got to solve that problem. And if I could just think about all these things and what I've learned over the last few years since my first startup visit, just a few things. I was thinking about toddlers, right? They're not afraid of doing things, they just do it. And I think the same is with startups. If you're here and have an idea and you're questioning anything, just do it, go for it. The courage comes later. You just have to take that leap. The second thing is really know your why. So for me, knowing my why was I need to make healthcare better for people and I need to make it better for the nurses. It's never been more clear to me. And when you're so clear in your why in it, there's no question about what's the right thing to do and what's the right decision to make. Also build your tribe. Dr. Hall is a huge part of my tribe. The doctor who came in at Mayo Clinic and knelt down and told my grandmother her cancer came back. He's also part of my tribe, a huge part of my journey. Like I said, open every door. Everything in your life happens for a reason. I've never more firmly believed that now. Everything, every person, everything, every experience has led me to exactly where I'm at today. You just have to pay attention and follow what you're feeling. And that just really comes with listening and learning. I think as nurses, we're taught to really listen and ask the right questions, and when you pay attention, then you'll know exactly where you need to go. So just a little bit about me, but happy to answer any questions that you have.
Yeah, we love questions.
Or pictures
Doctor,
too.
you has a question. Chris has a question over there.
It's you.
Or a comment.
So you guys met several years ago. What have you learned about each other since, and how has that helped you build Naviverse?
Oh, wow. I'll start. Well, you first. So just so you know, what comes with retirement is that I get really emotional really easily. And so I've only cried publicly a couple times. And it's always when I'm talking to her around Jasmine. And that's what I've learned is she's just a very giving person. And so, my hope So with my startup, with the Heal Lab and the people that are in our advisory board, when I sign up to be an advisory board member, I give them a book. It's called Founders at Work, because all this history of all these tech companies that started, like Excite and Microsoft and Yahoo and all of them. And one of the most interesting ones to me was PayPal, because the founder of PayPal came into a small lab, or it was a session like this, but not very many people showed up. But the person who came to speak, I think it was Peter Thiel, came to speak, and then the student said afterwards, hey, there was, again, it wasn't a lot of people that showed up, but it was like an event that the university put on, and Stanford, I believe. And the student said, hey, I would love to meet with you for coffee. I've got an idea to start online banking. And he said, sure, let's go get coffee. And we started PayPal. And so I thought, that's so cool. I read this in a book, like 20, 30 years later, that we just put on events and introduce people to each other, and then maybe good things will happen, right? And so that's been like, for me, it's been like having the Heal Lab has been, we're going to start up a lot of things, and some of these are going to fail, some of them are going to make it, doesn't matter. But my hope is that somebody makes it and then gives back. Like, we started to Heal Lab with no money. ASU, I was at the Emeritus lunch yesterday, and someone said, what I've learned is ASU is University of Yes. And if you come to ASU to teach, and you have an idea, and you want to do it, and you can fund it or find a way to fund it, ASU will say, sure, go for it, yes? And that's exactly what happened. That's been my experience with the Heal Lab. I had no money to start the Heal Lab. I got people like Chris to come around and actually give us money. Like, hey, you guys want money to advisory board members that you guys can give? I give as well. And let's start up. And maybe something cool will happen. And then it happens. And then we were at an advisory board meeting about a year ago. And Jasmine came and she was sharing this and giving an update to the board or where she came. And she, along with one of their patients, started a scholarship to help future nurses at ASU, and that I lost. So what I've learned is she's this amazing person, and people don't know it works. So the people who work with startups will tell you this. It's usually not the product; it's usually the people. And investors will tell you this too. I hear it over and over and over. It's the people. And you can take her and Gloria to like any startup, and it's going to just be amazing because she's there. And it's the people that matter. So,
I really second all of that, like finding your tribe, finding your people, and when you find someone, especially like for me, Dr. Hall, like the mayor earlier said, people are going to tell you no, and you're going to hear no, and that's okay. Like those are good, and things aren't going to work out the way you maybe would have liked, maybe not the first time, maybe another time. But Dr. Hall is always just like, okay, here go, like just the biggest cheerleader for me, I think, and especially as you're growing and things change, like you never know that it's going to break. Right? I wake up every day and there's so much uncertainty and ambiguity. Like, I don't know what next month's going to look like. I have no idea what next year's going to look like. But I have people around me who are so supportive and help me think, sometimes in ways that I can't. And Dr. Hall is absolutely one of those people. And it's always like, hey, look at this opportunity. Try this. Like, think about this. And that momentum in the beginning, honestly, was like so important for me when I had no idea what I was doing. Like, I'm a nurse. I know nothing about business.
You did it on purpose. He was there when I cried the first time. I would say that I think Phoenix is a very supportive environment. And so when I ask people to be in the Heal Lab, they're like, yes. And when the city of Phoenix is like giving us money for almost every event I ask them for, like this 7 million, like city of Scottsdale, city of Tempe, like all I have to do is ask. We're going to put on a workshop and we just need help with some of the costs for it. And they write us checks. And everyone cares, and we all play nicely. So, I can't tell you how many meetings I did with the Arizona Commerce Authority, the Greater Phoenix Economic Council, the Flynn Foundation. I remember before the microchip company started being developed, I remember years of people coming in my office and talking about what is the ecosystem like here. Because they were looking at a couple different places in the country to put it, and they decided to put it here because the environment is so here, so supportive. So, all right, next question. None like that. Yes, go
Told
ahead.
you not to like call.
Yeah.
Let's do it.
Yeah.
One more, okay.
I was actually part of the first days of YESPHX cohort. And I'm very excited to see all of those. But I'm not a current student, so I was just curious if there any of these opportunities are available for alumni or
Everything that we mentioned except for Venture Double is actually available to community members as well. But Flint Foundation is on Commerce Authority, like Peer Green Summit, they all support entrepreneurs. The Flint Foundation does a $30,000 a year to startups, and they'll give you mentorship as well. And it's the mentorship that's more important than the money. $30,000 sounds like great, and it sounds like a lot of money if you're a student. And then when you're a startup, you're like, that's going to help me for a week or so. But it's the mentorship that really helps. And so all of those are available, and I would usually the venture level is available, and I'm available. So like I don't think I would either. I like to be a part of the story. I want to be in that book like 20 years from now, because you're like, I'll be in Jasmine's story because she'd be like, yeah, I went into this field lab, and she wasn't even a student. She was really a faculty member at that point, coming to bring her students. So I want to help you if I can help you. If I can't help you, I'll be glad to tell you that as well. The best thing about me is that I have a good network. And so what I really do is I'll put you in touch with people, and I'll know who to put you in touch with.
And he's really kind and caring too, so don't make that.
And I cry easy. Anything else? We got one more.
Hi, this is for Jasmine. I'm kind of a fangirl. I've been hearing about you for years in the circles that I'm in, and so I just want to congratulate you first of all. But also to ask you, what was your biggest challenge in being a disruptive pioneer in this area?
Well, first of all, thank you so much. It's such an honor to be here, and the fact that people are looking and paying attention, it means a lot. Not only as a female, but also a minority, and also as a nurse. I remember one day I was getting my pitch and went around and giving nurse feedback, and I remember this incredibly educated older gentleman, and he said, "There's nobody else other than you that's meant to be the CEO of the company." And that was really meaningful to me because earlier I had a conversation with a mentor who says, "You should actually hire a CEO to come in because you don't know that business. Let them run it, you just go be the hype person." And I'm like, no, that doesn't sound right. I need to lead my nurses. They need a nurse leader. And then the same gentleman proceeds to say, "But I can't believe how smart you are for a nurse." And to me, I was like, wow.
Just trying.
My biggest hurdle actually is teaching the world and our nurses ourselves what we're capable of doing. And how we can make an impact in healthcare, because we're usually not heard, we're not listened to. And so for me, that is my biggest struggle moving forward. It's how do I change the world so that they can receive us better and understand the value that we bring. The $1.5 million grant that we received, it's for free nursing care. We're helping people go home from the hospital. Our nurses come to the hospital, they get bedside report, we take them home, they come all settled in, they're organized. Even going in and telling them, hey, we have a nurse for free, it's going to do this for you. They struggle with that. And so for me, I think that's probably my biggest struggle, is just working against just people that don't know, or how do we change how we as a profession have portrayed ourselves for so many years.
That guy doesn't seem very smart, to say, right? I would hope that nurses are smart, right?
Yeah, we get smart.
Let's give it up for Dr. Hall and Jasmine.